community service. I'm sure we all recognize that sound. It's the sound you heard in your mom's uterus. It's the sound you hear in your ears when you're scared. It's the sound I hear when I listen to somebody's chest. That's a heartbeat. I'm here today to talk to you about heart health. So to begin, I'm just going to give you a little bit of background about the structures of the heart. So the blue shows deoxygenated blood, or blood without oxygen, and the red is oxygenated blood, or blood that has oxygen. So the blood comes into the heart through the superior vena cava into the right atrium. The right atrium then contracts and sends the blood to the right ventricle. The right ventricle contracts and sends the blood up the pulmonary trunk and through the pulmonary arteries. The pulmonary arteries head to the lungs, and this is where the blood exchanges its carbon dioxide for oxygen. The blood returns from the lungs to the heart through the pulmonary veins, located here and here, and here and here. All of these veins flow into the left atrium. When the left atrium contracts, it sends blood into the left ventricle. The left ventricle contracting sends the blood into the aorta, which distributes the oxygenated blood throughout the body. Okay, so according to Health Canada, heart disease has far surpassed cancer and car accidents as the leading cause of death of Canadians. Some common heart problems that are part of heart disease include hypertension, which is also known as high blood pressure. Blood pressure is the force of the blood on the walls of the arteries as the heart pumps. So high blood pressure is when your blood pressure is higher than 140/90 milligrams of mercury. An ideal blood pressure would be 120/80. Another common heart problem is inflammation of the arteries, the linings of the heart, and the plaque deposits within the arteries. Plaque deposits are not normally there, however they develop after a diet or after a lifetime of a diet that's high in cholesterol and high in sodium. So both inflammation and hypertension can lead to heart attack and stroke, and often go unnoticed or undetected by the people that have them. That is why Health Canada refers to specifically hypertension or high blood pressure as the silent killer. So the most effective way to improve your heart health is to adopt an exercise plan that includes physical activity for 30 minutes a day, every day. This is a difficult achievement and it takes a lot of time and commitment. And this is a time, commitment, and life change that I encourage you to make. And because it takes time, I'm here today to present with you a couple of quick, easy ways that you can improve your heart health. And they're fast, they're simple, and they're effective. To begin, reduce your sodium intake. Sodium is salt, like table salt. According to the Journal of Women's Health, a high sodium diet is a major contributor to hypertension. This is because when you have an excess amount of sodium in the body, it increases thirst, and it can also lead to obesity or being overweight. So these are all contributors to high blood pressure. Your suggests that you should keep your sodium intake at 1,500 milligrams or less per day. A simple way to do this is substitute other spices for salt to add flavor to your food. Some examples are basil, rosemary, things like that. They add the flavor without the sodium. Other things to be aware of are high sodium foods, especially processed foods. For example, 1 pack of Ichiban has well over half of your daily value of sodium. So because it's important to watch your sodium going into your body, it's also important to watch where that sodium is going in. I'm talking about your oral health. Contrary to popular belief, your oral health has a huge effect on your heart health. Okay, so the way that this works, you have a lot of bacteria in your mouth, and your gums are the first defense against keeping that bacteria in your mouth and not in your blood. However, poor oral health gets the bacteria numbers way up and also causes inflammation of the gums. When the gums are inflamed, they're a lot more tender than normal and they're a lot less resistant to tears. So when your gums tear, it creates a direct path from your mouth to your bloodstream for this bacteria to travel. This bacteria, which is not necessarily harmful in the mouth, is harmful to the heart. It causes what I talked about before, the inflammation of the arteries, the heart lining, and the plaque deposits within the arteries. So the best way to improve your oral health is simple. Brush your teeth. Use a normal toothbrush with soft bristles. Hard bristles can actually scratch the gums and cause them to be more tender than not brushing. So it's important that your toothbrush has soft bristles. Next, floss. Flossing is so easy. You take an arm's length, make sure it gets between every single tooth, and you're good to go. You only need to floss once a day, and the best time to do this is before bed. It's a really easy nighttime routine. The last thing with oral health that I'm going to talk to you about is an OraBrush. This is an OraBrush. for cleaning the tongue. Most of the bacteria in your mouth is actually on your tongue, and by leaving it there, you develop a tongue coating, which is just a thick layer of food and bacteria that is left in the mouth. The oral brush unabrasively removes the bacteria from your tongue without damaging the taste buds. Brushing your tongue with your toothbrush can actually damage your taste buds and alter your sense of taste. So using an oral brush is important to take the bacteria from your mouth without damaging your taste buds. Oral brushes are available here in Lethbridge at London Drugs and at many other drugstores around, so they're easy to find. So the most effective order for your oral health care routine is to floss, brush, then do tongue care. It's not recommended that you use a mouthwash with alcohol every day because the bacteria in your mouth can actually become resistant to the alcohol. That causes bacteria that are harder to treat if they cause an infection. So the final tip that I'm going to give you to improve your heart health is just to simply reduce your stress. I touched on this a little bit in my holistic health speech. Reducing your stress can include activities like exercise, gardening, meditation, and even laughing. Laughing is the body's natural way to reduce the stress hormones. So some effects that stress has on the heart include things like atherosclerosis, which is a narrowing of the arteries. This contributes to high blood pressure itself, as well as an increased heart rate. So, because heart disease is the leading cause of death in Canada, it's important for you to do what you can to protect your heart, because for most people, you only get one. So here's the few simple things you can do to help your heart. Reduce your sodium intake, take care of your mouth, and manage your stress. Improving your health and lengthening your life is things that can happen if you improve your heart health. So it's important to remember that an active lifestyle is extremely important in maintaining your heart health, and if you have any questions about your heart health or your health in general, I encourage you to see a doctor. This is my persuasive speech, and my name is Devaney Service. Thank you very much for your time.